Okay, I have my barium, a cup and a straw, a gown, gas crystals, a compression paddle, and then I also have a pillow, a sponge, 45-degree sponge, and a shield if the patient is childbearing age. Now I'm going to go get the patient. Faith?
Yep.
Hi, my name is Landon. I'll be assisting the radiologist in the UGI today.
Okay.
Can you confirm your last name and date of birth?
Yep. Oakley 81104.
Okay, and so what brings you in today?
I've just been having stomach pain and acid reflux for the past month or so.
For the past month or so?
Yep.
Have you had any recent surgery such as weight loss surgery?
Nope.
Nope. And then do you know of any perforations or holes in your GI system
Nope.
that you're aware of? No? Okay. Have you ever had a UGI before?
No.
All right, so basically what we're gonna do is the radiologist is gonna come in here. You're gonna be up on that table. We're gonna give you some barium. It has a chalky texture. Some people kind of say it tastes like a milkshake. And that's just gonna highlight your stomach and your esophagus so we can see that better.
Okay.
We also have some gas crystals if he wants to use those. And yeah, we're just gonna take a look at what's going on in there, okay?
Okay.
Is there any chance of pregnancy today?
Nope.
All right, before we begin, I'll have you change into this gown. Go ahead and remove any metal that's from the shoulders down.
Okay.
And then you can leave your clothes on unless you have a bra on that has plastic or metal.
Okay.
That's just gonna cover up your clothes so we don't get any barium on them, okay?
Okay.
Let me know when you're ready.
I'm ready.
All right, you can come on over here.
Okay.
Have you step up on this. I'm gonna go get the radiologist. I'll be right back. Okay, Dr. Lenter, this is Faith. All right, we're all done. Dr. Lenter wants 4 images, so we're gonna do that here quick. Shouldn't take too long. I'm gonna grab this pillow, put it behind your head, and then I'm gonna tilt you back. Okay, it's gonna feel like you're falling, but you're not. It won't go too fast. Okay, just gonna move this out of the way. Okay, I have a 40-inch SID. All right, Faith, I'm gonna have you roll onto your left side for me. I'm gonna put this sponge under you.
Good.
I'm just gonna kind of straighten. I'll actually have you, I'm gonna push this up a little bit. Okay, come back down. Okay. All right, I'll have you put your arm up just across your chest, just like that. We have a 45-degree sponge. The average is 30 to 60, so we're just gonna use the 45. And then I'm going to feel the xiphoid process in the lower border of the ribs on the left side. And I'm just gonna center in the center of that. Scoot your table down here a little bit. I'm gonna march the side down. Field size is a 14 by 17 and a 40-inch SID. Faith, go ahead and take a deep breath in. Blow it all the way out. Hold it out, don't breathe. That technique was 15 at 110. We see the entire stomach and duodenal loop shown, as well as the fundus of the stomach filled with barium and the pylorus and duodenal bulb free of superimposition. All right, Faith, I'll take this sponge out from under you, then I'll have you roll up onto your right side for me. Just gonna straighten you out a little bit. I'm gonna have you bring your legs forward there, okay? For this one, I'm going to feel for the crest and the xiphoid, and I'm going to center in the center of that, or between that. Wrong way. And then I'm going to also come the anterior, 1/3 of the abdomen anteriorly. Okay. Marking the side down. I'm going to be at a 10 by 12 field size. Okay. Go ahead and hold still. I'm going to shield you. All right, Faith, go ahead and take a deep breath in. Blow it all the way out. Hold it out, don't breathe. Exposure, you can breathe and you can relax. I was 30 at 110. You see the entire stomach and duodenal loop seen, and there's no rotation, which is seen by the vertebrae in a proper lateral position. Okay, I'm gonna grab this. Then I'm gonna put the sponge back under you, and I'm gonna have you kind of lay up on your stomach here. Oh, sorry, dear. Okay. I'm going to center on the lower border of the ribs, 1 inch lateral to the vertebral column. Field size stays the same, 10 at 12, 40 inch SID. All right, I'm gonna shield you. All right, Faith, go ahead and take a deep breath in. Blow it all the way out. Hold it out, don't breathe. Exposure, you can breathe, you can relax. That was 15 at 110. You see the entire stomach and duodenal loop. The pylorus and duodenal bulb are free of superimposition. Okay, last one here. Let me grab this sponge out from under you, and I'm just gonna have you lay it flat on your stomach here. I'm centering between the xiphoid process and the lower border of the ribs, 1 inch lateral to the vertebral column. Field size is still 10 by 12. Take a deep breath in, blow it all the way out, hold it out, don't breathe. That technique was 15 at 110. You see the entire stomach and duodenal loop, and the body of the stomach is filled with barium. Okay, Faith, we're all done. I will move all the stuff out of the way and get you down here. Okay. I encourage you to drink a lot of water in the next couple of days to get that barium out of your system. If you see white stools, that is common. If you don't have a bowel movement within a couple of days, then I would contact your physician, okay?
Okay.
All right. Thank you.
Thank you.
How about